Continuing with our question and answer session, today I am pleased to invite my colleague and good friend, Dr. Krishnaraj. Welcome, Dr. Krishnaraj. Let me introduce you to Dr. Krishnaraj. He's done his oral biology from Rutgers University, USA, and he's a well-known researcher, a professor, and a keynote speaker with multiple publications in national and international journals and magazines. He's a key opinion leader for a number of global dental companies as well. So, should I get started with the first question, Dr. Krishnaraj?
Yeah, sure. Thank you, Amol.
The first one that we commonly get to hear is we get asked is about brushing and flossing. Uh, a lot of patients believe that brushing and flossing needs to be stopped when your gums bleed. Is that true? Do you have any insights to give on that?
So, Amol, you and me, we see patients like this on a regular basis. But the moment they see bleeding, they feel like there is something wrong and they should stop bleeding. In fact,
Absolutely.
so we keep telling our patients that the moment you start seeing bleeding is the time that you should be concerned, and rather than stopping the brushing, rather visit the dentist, because gingival bleeding is the first sign of gingival inflammation. So whenever your gum is bleeding, it's because of some bacterial infection in your gum. And rather than stopping your brushing, which will only increase the inflammation, better visit the dentist as soon as possible. That a simple cleanup will help solve the problem.
A lot of patients also believe that this simple cleaning that you just mentioned just now, what we call as scaling or oral prophylaxis, it tends to weaken your gums and weaken the tooth. Is that what are your what's your opinion on that?
Yeah, I think, Amol, I mean, in our practice, we always find patients who try to take the easy way out. And when we tell scaling is necessary, they'll think that, Dr. Saab, my friend had a scaling done and his start tooth became loose after the scaling.
Exactly.
We try to educate the patients that the support to the tooth comes from the gums and the bone below it. And if you
Absolutely.
don't, and the plaque and the calculus that gets built is full of bacteria and bacterial products, and these toxins will start destroying your gums and your tooth, and then over a period of time it will weaken your tooth further. So if you don't do the scaling, definitely your teeth are going to get worse. Yes, if you do the scaling, there will be an initial couple of days where some amount of mobility is seen, because the tartar itself can sometimes act as a supporting agent. So people
Right.
get confused that it is because of the scaling that your tooth is shaking, whereas in fact it is a vicious cycle, and if you leave it,
Right.
it's going to cause more and more of the mobility. So yeah.
A lot of young patients believe that they are not prone to getting gum disease. They believe that gum disease is something that only the elderly or the older people will have in their mouth. Um, Sometimes I want to laugh over these kind of things, but let us be a little serious and answer the yeah.
Well, I'm telling you, I will side with the patients here to a certain, because not only the patients, even I used to think that young people, why would they get a gum infection, right? And I always used to think that the older you get, your immune system goes down and things go down. Only then you start getting infection. Why younger people get? So you would not believe, when I was doing my PhD, I actually did not brush for 2 days and 3 days, and I took a blood sample, and then I ate an apple, and then I did a blood sample, and then I found bacteria inside my blood. Right? So obviously, whether you're young or you're old, the bacteria doesn't recognize what is your age. It
The
only
age,
recognizes,
exactly.
bacteria recognizes the gum. It recognizes that it has good nutrition, and it feeds on it. Now,
Absolutely.
whether you're young, whether you're old, We have chronic periodontitis. Even we have nowadays situations where the kind of periodontitis or the gum infections that we call to be aggressive forms also. So people at any age, I've seen the youngest person that I have seen lose their teeth due to gum disease was 14 years old. So that's the
Wow.
youngest. So the 12 is the age, that we get all the natural teeth. And by the time
Right.
the patient was 14, they're already almost lost 70% of their teeth. So from 14 all the way up to 75, 80, we see gum infections at any age. And people have to be responsible, aware that this can be corrected if it is stopped and detected at an early stage.
Is it normal to get a little bit of bleeding in your gums when you're brushing and flossing, or
Yeah.
you shouldn't have even a spot of blood? What's your take on that?
See, some amount of subclinical inflammation will always be there, but a lot of times the bleeding is more often than not, the bleeding is as a result of gum infections. In rare situations, sometimes people use abnormal force when they are
Uh-huh.
brushing and they injure their gums. That can
Right.
sometimes lead to bleeding. Sometimes even
Right.
flossing, they go quite deep into the gingiva, into the gums, and they try to floss quite hard. It can lead to some amount of bleeding, but that's the 5% or 10% of the cases. Majority of the cases, the gum bleeding will always be as a sign of gum infection, which is beginning, or gingivitis as we call that.
Right.
In fact, I think Guinness Book of World Records also says gum disease to be the most common
Most
infection
common, yes.
human.
Absolutely. Yeah,
Even
I remember reading that. Yes. That.
every person at some point or other in their life, include dentists included, will suffer from some sort of gingival inflammation.
What would your opinion be on the type of brush to be used, and hard, medium, soft, super soft, ultra soft? You have so many of them available in the market nowadays.
So I don't recommend hard brushes, because they can
Right.
sometimes injure your gums. So how do
Yes.
you? We generally go with a medium brush or a soft bristle. Medium should be okay. Soft is recommended for people with known gum infections, where there is a weakened gum there, or post treatment, post surgery. Sometimes we recommend softer brushes or softer bristles. Otherwise, a medium brush should be sufficient. Make
Mhm.
sure that the brushing force is correct. And a lot of times I get asked that what is the right brushing force. Now, if I tell them it's
Right.
like 20 newtons, they won't know what is. I tell them that you press the nail bed. When you press our nail bed, it becomes white, or it gets blanched. So the amount of
Right.
that it takes for your nail bed to get blanched is the amount of force that you have to apply on your gums. So that way it becomes very practical for them to kind of understand what's the exact amount of.
Yeah, a
Or,
layman would be able to understand that much more easily. That kind of, yeah,
yeah.
absolutely.
So one
Uh,
is to use medium brushes, avoid hard brushes, medium to soft brushes, and use the right brushing technique, use the right amount of brushing force, and keep changing your brush at least once in 3 or 4 months. Then that should be an optimal way to maintain good gum health.
Thanks a lot, Dr. Krishnaraj, for your time. Let's do this kind of a question answer session one more time with some another interesting topic for the benefit of our viewers. Thank you once again.
Thank you, Amol. Thank you, and it was really a nice opportunity for me to interact with you. I've heard a lot about you and your wonderful patients and your feedbacks that you receive from your clinic, and you are truly inspiring. When I see all your wonderful patients that speak so volume about you, so kudos to you and Sunita, and looking forward to more such engagements. Thank you for this
Yes, we
opportunity.
will. Thank you very much. Thank you.